Hello, everyone. Welcome to Endwell Live, where each week we're having a conversation with a special guest about how, in this unprecedented time of crisis, we can collectively find community and best support those facing serious illness, support caregivers and families. I'm Shoshana Ungerleider, a physician and the founder of Endwell, where we're focused on making the end of life a part of life. And I hope that you're all safe and healthy out there. And if not healthy, I hope that you're on the mend. We are all living in a new reality here, one of connection through screens, where we're wearing our dress shirts on the top and our sweatpants on the bottom. I'm coming to you live from my home in San Francisco. And we're here today to find community in one another and to support our physical and our emotional health through this virtual conversation. And today I have the pleasure of speaking with Dr. Sonali Wilborn, who's the Chief Medical Officer of Heart of Hospice, an amazing organization that provides hospice care in 16 regions across the US, Arkansas, Louisiana, Mississippi, Oklahoma, and South Carolina. We're gonna talk for about 15 minutes and then open it up to you all, our audience. Please enter your questions down below in the comment section. And then please go ahead and share this Facebook Live link right now on your own page so others can join in. And a special thank you to the Cambia Health Foundation and the Tauber Family Foundation for their support of this program. So welcome, Sonali. How are you doing with all of this?
Hey, good afternoon, Shoshana. I am doing well, and thank you very much for having me on the show. It is an honor and a pleasure to be here and to speak with you and your viewers today. You know, it's interesting times that we live in, as you mentioned, but I have to say that the healthcare has been able to kind of, think outside the box and innovate, which I'm really, truly thankful for. And all I can say is that, as Einstein said, in the midst of every crisis, we find opportunity, and we truly have found opportunity.
Yeah. So you started your position with Heart of Hospice back in last year, mid-October. And then come this year, mid-April, you've opened a temporary inpatient unit in New Orleans for hospice eligible patients with COVID and then people under investigation. That's just incredible. Can you tell us how you and your team made this happen?
So without oversimplifying it, right? It's being at the right place at the right time and having the right people around you. So before I answer that question, I'd like to give you a little bit of background so it somewhat makes sense, if you will. So Heart of Hospice is probably the largest hospice provider in Louisiana. And what we were finding in New Orleans when it got hit with the surge, the hospitals were getting inundated with patients that were sick and were coming in with COVID and were being tested COVID positive. What we were also hearing from our colleagues and the hospitals is that the patients clearly, the number of patients sort of overran their capacity. So they were over capacity for their ICU beds, they were over capacity of the ER beds. And basically what was happening is they were almost approaching it like a wartime approach, if you will. Mm-hmm. So a lot of the time it was really taking a look at these COVID-19 positive patients, some of whom were extremely ill, some of whom they recognized right from the outset were unlikely to recover from the illness. And what was happening is that our healthcare team in New Orleans sort of had a split focus. They were trying to provide the aggressive care to patients that actually were likely to recover and get better, but at the same time have patients in the hospital systems that could not be discharged, could not go back home to their families, and did not have end-of-life support because the hospitals, as you know, like the nursing homes, had been all pretty much closed to outside visitors. So what was happening is that we were hearing from colleagues in the hospital that patients were basically dying in the ERs, sometimes in waiting rooms, sometimes in the ICU, and without necessarily the benefit of end-of-life support, and certainly without family members at their bedside. So recognizing this as an opportunity and a need for our communities, we just had this crazy idea to go ahead and figure out, is it possible for us to put together a pop-up hospice inpatient unit? And I voiced that on one of our leadership calls, and our CEO immediately said, well, you know what, there is certainly a need. Let's go ahead and figure out how we can do this. So that's what started sort of all of us running down multiple lanes, as Carla, our CEO, would say. She started reaching out to the Medicare contractor, Palmetto. She started reaching out to our parent company, EPI. Cindy Frazier, who is our Chief Compliance Officer, started having conversations with the state to figure out if we could get licensed. In addition, multiple members of our team sort of started looking for location. We identified partners who could maybe provide the needs for the patients. And as soon as we identified the location, which was at East Jefferson Hospital, it was literally all systems go. We identified physicians who could round there. And 10 days after, literally 10 days after we started having the conversation, we were ready to take our first patient. So we got licensed, we found the location, we were able to get our partners, our vendor partners, to meet our supply needs. And it was just truly incredible. So that's really in a nutshell how we pulled this off.
Oh my, I am like stunned. I mean, in a traditionally very slow moving system of healthcare, and those of you watching know what I mean. If you work in healthcare, in 10 days, it's incredible that you were able to make that happen. I mean, it just shows you that when there's urgency, and people are willing to work together, amazing things can happen. So my goodness, I'm thrilled. So tell us, for folks that aren't quite as familiar with hospice, sometimes hospice is offered in the home, sometimes it's offered in other facilities like a nursing home, and sometimes it's in the hospital, like as you mentioned. Obviously, these are extreme circumstances, but can you tell us why, in particular with COVID-19, it's important to also offer hospice in the hospital, a place where you traditionally wouldn't, think of hospice care?
I think that's great questions, Shoshana. I think all of us recognize real quickly that the sickest patients oftentimes go to the hospital. So in this particular pandemic, what we were seeing is that our hospitals were completely overrun. Our hospital systems were severely taxed. And then unfortunately, a lot of what was happening was that the focus was really on patients that were likely to recover. Not to say they weren't taking care of patients that were ill and unlikely to get better, but still the focus was on those that could recover and go back home. So what we found was that patients were dying, as I mentioned earlier, in the hospital, in the ICU beds. And really that's what made us think in terms of why it was the right setting to offer hospice, because a lot of these COVID-19 patients who were extremely ill, who were unlikely to recover, were suffering from multiple symptoms. We know from the media and reading all that we know, all the stuff that we hear in the community, that patients experience significant respiratory distress. They have trouble breathing, they have chest pain, they're having strokes. So all of these symptoms certainly were best supported, we felt, by providing hospice care. The other reason I think it's really important, and why we felt it was important to offer hospice in a hospitalized setting, in the setting of COVID-19, was because we were able to negotiate a contract so that we could get family to the bedside. Now, I think one of the worst things that can ever happen is for us to die alone. So being able to provide hospice in a hospital setting for these sick patients that cannot go home, that need aggressive supports, that need acute symptom management, and to be able to do that safely with their family present at their bedside was really what challenged us to bring this to the hospitals.
Yeah. Well, I want to hear more about the idea of bringing families in. So the stories of people dying alone that we're hearing in the media, and the helplessness that their families are feeling when they're separated, are just devastating, right? I mean, how were you able to make it possible for families to be there and visit their loved ones when so many places across the country aren't able to do that?
So what you're hearing out in the media is probably the tip of the iceberg, right? I mean, those are a few stories of people. It is an absolute reality that our patients who are dying in the hospitals, one such, our very first patient was actually this elderly gentleman who had been in a nursing home for several months. Actually, he'd been there for a couple of years. That was his home. And since the COVID-19 pandemic hit, the nursing homes had pretty much closed their doors to family and visitors. So he had actually not seen his family members for over 6 weeks when he started experiencing shortness of breath and fever. So the nursing home actually sent him to the hospital. And of course, in the hospital, he was diagnosed with COVID-19. And despite all aggressive measures, it was a quick recognition that he was not going to get better. So at that particular point in time, it coincided with us opening up our hospice inpatient unit. And he was the very first patient that we took care of on our unit. So the story is real. Patients are dying. What was really important is because of the work we were able to do, because of what we were able to negotiate with the hospital, we were actually able to get family members to this patient's bedside. What we're doing is once we've identified that somebody is appropriate to come to our COVID-19 unit and they're eligible for hospice, we're actually coordinating with the hospital, we're coordinating with the family, we're coordinating with the physicians to make it possible to transfer these patients into our inpatient unit. And once we do that, in the unit, we're providing the care to these patients and to the families with 24 hours a day, 7 days of hospice nursing, hospice aid support. Now, our team has been phenomenal. We've had people volunteering from other parts of our team in other parts of our country who've left their own families and come to New Orleans to be able to staff the inpatient unit. I mean, it has been a tremendous effort. And what we've done so far is we've taken care of 40 COVID-19 patients on our hospice unit so far, and we've been open for 2 weeks, just a little over 2 weeks.
Amazing. And I assume that when family members do come and visit, you're doing things like making sure they have appropriate protection from infection and exposure and those kinds of things. Yes.
Absolutely. And that's what's been amazing about our team is that we've actually been incredibly proactive about sourcing PPE. We've made sure that we've stocked up to have enough PPE to get at least 2 family members to a patient's bedside on a daily basis. We've got a ton of education that we have available to talk to patients and families about basic infection control. So we are very well stocked. And in addition to that, the Heart of Hospice team is actually doing a lot to keep our staff members educated to make sure that they're providing the right care. We're doing weekly town halls. We're talking to them about the CDC updates. We're telling them about treatments and infection control as things change. So we're doing a lot to support our teams and making sure the families are safe, which is, of course, key.
Yeah. And what about care for patients who are able, of course, and prefer to be discharged and go home? And is that possible in the setting of COVID? And if so, how can families and caregivers from outside organizations, like yours, like stay safe in doing so?
Another great question. I mean, what hospice does is hospice as an entity we pride ourselves in providing what we refer to as an individualized plan of care. So we really pay attention to what's the most important thing for the patient. So if it's the patient's wishes and the family supports going home, then that's what we as a hospice team do. So the way we do that safely is, again, once we identify it's the patient's wishes to go home, we are working with the hospital that referred the patient to us. We're trying to ascertain from the hospital, what are the patient's needs? What medication needs do they have? Do they have any needs for medical equipment in the home setting? And once we've got a really clear understanding of this, we're then coordinating a transfer for this patient back home, making sure we take all necessary precautions. So these patients get transported back home to their homes. And in the meantime, what we're doing is we're educating the patient's family members about what's safe, how to provide the safest care to the patient in the setting of COVID-19.
Yeah.
So those are some of the things that we're doing. And like I said, we're supporting our team to make sure they are able to provide the family with education on how best to care for their loved ones. And the other thing that we forget in the midst of making sure that people are safe is we're also equipping our family to be prepared on how to handle things like, how do you handle a particular symptom? What medication should you give? So we're educating our family members about how best to take care of their loved ones. And the last thing that I'll say we've been able to do very effectively is we've actually deployed televisits. So we are available via telehealth. We've got our nurse available, our social workers, our chaplains, our physicians can get to the patient's bedside via telehealth pretty quickly. And we're doing that across all our sites.
Fantastic. And another example of innovation that's happening amidst COVID. That's wonderful.
Absolutely.
Folks watching out there, please ask your questions in the comments below, and we'll get to those in a little while here. So Dr. Wilborn, well, hospice is covered by most insurance, right? But there are people who fall outside of those safety nets. How are you making it possible to care for them regardless of their ability to pay?
So I'd like, we are really payer agnostic a lot of the times, if we have a patient that gets referred to us who's eligible for hospice and the patient and the family consent to receiving care, we bring them on and provide hospice support irrespective of their ability to pay. So our frontline staff oftentimes have no idea whether the patient has a payer source or not. So the care that gets delivered to a patient without insurance is the same as the care that gets delivered to a patient with insurance. So what we've done internally as an organization is we've recognized that we want to bring this care. So we've carved out some of our revenue to make sure that we're covering these patients. So that's really how we bring hospice care irrespective of insurance. The other really interesting thing that Heart of Hospice does is that we sometimes will bring patients on with aggressive treatments like radiation, other aggressive treatments like nutrition via IVs, things that traditional hospices don't cover. But we would do that simply because we recognize it's important to meet the patient and the family where they're at, and then sort of bring them on to a more hospice plan of care as they march through and as they progress along their illness. So those are some of the things our team really oftentimes does not even know that the patient has no insurance.
Yeah, wonderful. As a physician, what would you encourage patients and families do when faced with progressive illnesses, whether it's COVID or something else? Are there steps that they can take to make sure that their wishes are followed if they end up going to the hospital or something else? Like what would you recommend?
So it is my absolute passionate plea and advice to every single patient, to every person out there who's living with a chronic medical illness, is to talk about an advanced care plan, to approach their physicians about developing an advanced care plan and having an advanced care plan in place. I think it's really important for sometimes our patients to be the ones to reach out to their physicians proactively and ask them questions about what their illness is going to look like a few months down the road. What can they expect from the treatment? How likely are things to progress? So I think it's really important for our patients to reach out to their physicians to ask those questions and to talk about setting up a meeting with them to do an advanced care plan. For those who don't know what an advanced care plan is, an advanced care plan is basically a process by which a patient can make their hopes and desires for end-of-life care known. And it has three components, right? So the three components are kind of putting together an emergency plan, which refers to, in the event something bad happens, do I want to be on life support? So I think it's important for us to get that in place. The other piece of it is really making sure that they identify who in their family or friends will be the best person to advocate for them should they no longer be able to make those decisions. And then the third piece of it is talking about how they want their end of life care to be. I, for one, for sure, would like to be bathed twice a day. Do not let me smell under any circumstances. So I think it's really important for us to be able to write down and to share what it is, how we want our care managed. And that, I think, is probably one of my my biggest recommendations to folks out there who are dealing with chronic medical illnesses. It's really important to have an advanced care plan. And I will tell you that studies have indicated that patients and families who have had an advanced care plan in place, the patients have a much better outcome. They have a much better overall experience as far as their healthcare experience. And the most important things is that they relieve the stress and the burden from their family members, because these are their decisions and their families is just carrying it out. So I think it's a great thing to avail of.
In my experience taking care of patients, I would agree. I often find that to be the case. The more that families have talked about moms, dads, brothers' wishes, the better the experience for everybody. So, and especially now in this era of COVID, which is impacting everybody or potentially everybody, that to talk about these things is so important. We're going to open it up to audience questions. So please, if you have thoughts, comments, questions, please type them in below, and don't forget to share this link on your page so that others can join this conversation. So we have a question from Jamie, and the question is, hospice is based and thrives on in-person connection and teamwork. How do you help families reckon with getting hospice in the time of COVID? And especially because you're having to rely a lot on telemedicine. I think they're assuming that a lot of the care is over these televisits. So how do you deal with that, given that hospice really is best suited with a really hands-on in-person connection?
So I think there's a couple different things that get important at a time like this, right? The first thing is the first and primary most important goal is to make sure that our patients and our families are safe. You know, what we don't want to do is inadvertently cause a bigger problem for the patients and families. So the one thing that we're doing is, as I mentioned earlier, is we're making sure that our staff is fully equipped with full PPE. So if the patient and the family need a hospice team member, they absolutely will get the benefit of an in-person visit, irrespective, because we've equipped our staff members with full PPE, so they can go in and care for these patients, making sure that they keep themselves and the patients safe in a time like this. But I will tell you that a lot of patients have, interestingly enough, have actually embraced the idea of televisits. Now, oftentimes they're uncomfortable with having people from the outside, especially sometimes healthcare givers, because they're recognizing that as a healthcare provider, we may have been in front of other patients. So, you know, a lot of our patients have actually embraced the idea of televisits, and they're actually looking at it as a great resource. But the key thing to remember is that if a patient needs us at the bedside, we are at the bedside in the safest possible manner. That's what's important.
And another question from Jamie, how specific are you getting with families in terms of directions about how to stay safe and take precautions when they're caring for a loved one in hospice at home, or for example, if it's in a nursing home during COVID? I would imagine you get specific with them about how they can protect themselves. Can you tell us a little bit about how you go about that with families?
So we do a lot of education. You know, as I'm sure you're aware, the CDC has put out a ton of education. We've created internal collaterals by our marketing and communications team that's headed by this wonderful young lady called Kimberly Workman. She has put together a lot of resources that we can actually educate our patients and families on how best to care for their loved ones. You know, most of this education we're providing really in the home setting, because as I'm sure many of you are aware, that many of our nursing homes have really closed their doors to external entry. So anybody who's a visitor, even at a time as is like at the end of life, they're still, you know, pretty close to having people come in. So our education has really been to patients being in the home setting with family members who are their caregivers. We're doing a lot of education. We're supporting them. We're talking to them about, you know, appropriate infection control measures. We're talking about the importance of hand washing. We're talking about, in some instances, especially patients that have respiratory illnesses. We're trying to educate them on decreasing the use of nebulizers or switching to things that are less likely to be problematic. So those are some of the ways that we're actually educating our family members to care for their loved ones.
And last question from Jessica. How do you think the long-term impact of COVID-19 will impact the perceptions of hospice? And I assume she's talking about sort of society at large.
Well, I think the perception of hospice is slowly changing. I think we're seeing a slow but definitive shift. Hospice is no longer a place where people go to die, as is, you often thought of. It's really a place or a service that we avail of to have our best possible life, especially when we're faced with a terminal illness. So really focus on quality of life and spending the most valuable time that you have left with family members. I'm an optimist about hospice, and I'd like to hope that every single thing that we get faced with as a community, it just means that we learn a little bit more about end-of-life care that's available and people like yourself. I mean, people like yourself and organizations like yourself, like your organization, that are bringing this message. It's no longer scary to people. I would love for people to start having conversations in cafes about the importance of hospice and how we can support patients. So I'm hoping this COVID-19 pandemic will be yet another positive in bringing, shedding positive light on what hospice can do.
Yeah, I hope so too. And I'm feeling optimistic about it, that this sort of strange gift that COVID will hopefully bring us all, despite these extremely unfortunate circumstances, that we can be normalizing some of these conversations and bring these issues to light for everybody. So we want to hear from all of you out there and tell us, how has coronavirus changed how you feel about or prepare for serious illness, for caregiving, for the end of life? Please go to endwellproject.org/stories to share your story with us. And tune in next week for Pulitzer Prize winning journalist and author Matt Richtel, whose most recent book, An Elegant Defense, is really a fascinating exploration of the science of the immune system. So we're going to have a great conversation next week, next Friday at 11 a.m. Pacific, 2 p.m. Eastern. And I want to thank again the Cambia Health Foundation and the Tauber Family Foundation for their support of this program. And thank you so much, Sonali, for joining us today. It was wonderful to get to meet you virtually. And to everybody who tuned in on Facebook, it's communities and conversations like this that give me hope in these tough times. So please stay safe and well out there.
Thank you.